Yay, we're going to talk about adolescents. Adolescents are kind of tough sometimes. Some of them are uncooperative, but in general, I've enjoyed most of the adolescents that I've taken care of, and I think you will too. We're defining adolescents as ages 12 to 20 years old. So their final height is achieved once they go into puberty. The girls will grow 5 to 20 centimeters in height, and the boys will grow 10 to 30 centimeters in height. The weight gain will be, and this is per year, the weight gain will be 7 to 25 kilograms a year, which is 15.5 to 55 pounds. Or for the boys, 7 to 30 kilograms, which is 15.5 to 66 pounds. For the girl, the growth stops, important to know this, the growth stops 2 years after menarche begins. So, generally speaking, the girl can still grow after they begin their first menses all the way up to 2 years later, and then they stop growing. So after 2 years of the beginning of menstruation, they will not grow anymore. The boys' growth stops around 18 to 20 years of age. It will stop when sexual maturation has totally occurred. Pretty interesting. The vital signs are the same as the adults now, or should be. Now they should have both primary and secondary sexual characteristics. Remember, the prepubescence had around 9 years old. We said the girls will get, some breasts and some hair, and the boys it's minimal, but it begins. Well, now that these guys are adolescents, both primary and secondary sexual characteristics begin. And Tanner stages. Tanner stages are the different stages of sexual maturation. And we're actually going to go over that a little bit in class, but you can go ahead and read it up in your book. A big problem about adolescents is acne. And acne we'll talk about in class, but acne is an issue that, we have to help the adolescents with because it can ruin their self-esteem. So we're going to talk about your cognitive development of this age group. And for Dr. Piaget, he calls it formal operations. So this is the ability to think of more than 2 categories of variables at the same time. They can evaluate their own thinking. They can be imaginative, but also idealistic. They are more capable of using formal logic to make decisions. They do understand how actions can influence others. Pretty interesting. Dr. Erickson calls this identity versus role confusion. Now remember, think adolescent and don't think the 13-year-old so much. Think the 16 and 17 and 18-year-old. They develop personal identity and they view themselves as unique. Nobody is the same as they are. They are influenced a lot by their peer group. They see themselves as invincible. And we kind of know that because this is the age where there's a lot of car accidents. They take chances, they're risky, more boys than girls, but they're very risky at this age because they see themselves as invincible. For sexual identity, this is the age where intimate relationships may develop. Masturbation is prevalent. And for moral development, this group uses internalized moral principles to solve dilemmas. They question existing moral values of society and individuals. So, using moral principles to solve dilemmas, you know, I can't do that. And this is what we're hoping they're going to say. I can't do that because I'll get pregnant. I'm sorry. I like you a lot, but that's wrong. Or they might use existing moral values to society and individuals. So in our society, this age group usually has a curfew and they have to be home. They have to treat their parents nicely. They have to be respectful of their teachers. Their body image changes. Normality is based on comparison with peers again, and we've been doing that for a while. But their image established during adolescence is retained throughout life. So, unfortunately, the image that they get in adolescence is retained throughout life. So, if they are like the preppy kid and they think of themselves as preppy, they probably will be preppy even when they're 40 years old. If they think of themselves as, in the olden days, we called it goth when they wore all the old black, they're probably going to continue being an unusual dresser, or what would we say, a dark dresser when they are 40 years old. Social development. Peers are their social system. Friendships with best friends are stronger and last longer. Parent-child relationships change to allow independence. One of the questions I ask a 13-year-old in the exam is, what's the name of your best friend? If they don't have one, I'm kind of concerned. Are they isolating themselves? Are they a loner? Now, sometimes, kids will say, oh gosh, I belong to this group and I have 5 best friends. That's okay. Generally speaking, if I say, well, tell me which one is your very best friend, they usually will tell me. If they don't, we kind of get concerned that these children are isolated. Parent-child relationships change to allow independence. It's supposed to. Although some helicopter moms won't allow it to happen, it should, and they should be trusted if we brought them up correctly. So we'll see that in the hospital. Sometimes when you walk in a room, you should talk first to the adolescent and second to the parent. Or the parent might ask questions as you're talking to the adolescent. But first, let the child or the adolescent be autonomous and tell him what you're going to do next. Healthcare screenings, they definitely need scoliosis screening every year. And, it's very, very important. And we'll talk about that more in the ortho section of your book, but it's very important. We're going to screen for self-image and emotional well-being, mental health, and sexuality. We want to make sure, number one, the child that's not advancing sexually, they don't have breasts yet or whatever, it really affects their emotional well-being, and we need to talk about that and see if they don't need an endocrine workup. We also need to see if this child is depressed. This is a big age for that. Depression, food issues. We need to see what's going on with them, and we need to, ask questions that'll give us some guidance on how to help this child. We want to screen them for social and academic issues, relationships, and grades. We want to educate them on risk reduction. We'll ask them, are they doing these things? And then try to reach them to discourage things that are harmful to them. Sometimes it's hard. 13 and 14 and sometimes 15-year-olds, you can do it. But 16, 17, and 18, unless you have a great relationship with them, they're not going to listen. So it's important to have that relationship. We need to screen them for violence and injury prevention. Violence may be from a peer or a parent. They might have grown up with violence in their home and they don't know that it's abnormal. But at this age, if they're seeing you frequently, or they see you as a nurse that's a friend, they may talk to you about it and you can tell them that that's abnormal and let's get you some help. Dental health. Many times they have corrective appliances at this age, the mouth guards or the braces. They need to be encouraged to brush after meals, snacks, and at bedtime, and to floss daily to keep up with regular checkups, and they generally will need regular fluoride treatment. I want to also talk about nutrition. Perfect. Nutrition. This age group, now remember these, they need it more than anybody. Needs additional calcium, iron, protein, and zinc. Iron deficiency is big in the adolescents and mainly the girls, and it's probably when they start their menses, but it is huge. Calcium, this age group, thank you, Scarlett, this age group tends to get away from drinking milk and dairy products. And so we have to substitute if they're not going to do it. Protein, they really like their french fries and their chips. And so they're not getting protein and zinc. So, we need to substitute if they won't take it in, if they won't listen to us. They tend to lack, folic acid, vitamin B6, vitamin A, iron, calcium, and zinc. And they tend to lack it. It's inadequate in their diet. They need to have yearly assessments in height, weight, and BMI. Some people think if there's no immunizations at that visit or they did their high school visit, that they don't need to come back. But actually screening for all those things, for mental health, for nutrition, and now to make sure they're growing properly is very important. If they're not growing properly, there might be something wrong with their endocrine, and we really need to know that. Food disorders is a big issue for adolescents. It's kind of like body image issues. So sometimes overeating is a problem because maybe, there's, we know we overeat because it's a pleasurable or if we're stressed. And undereating is a problem if we're really watching what we eat, our diet, and not being healthy. And remember, they're not always as logical as they should be. So sleep habits change during this period, and it's actually a big complaint and a concern of a lot of the caregivers or parents of these children. And the reason it changes, it's due to an increase in metabolism and the rapid growth that we see during adolescence. In the early adolescence, it's more the girls. In the later adolescence, it's the boys because they grow extremely fast at that age. We also sometimes see them staying up late, completing their homework or talking on the phone or whatever, and then they want to sleep later in the morning. That's something that we can reason with an adolescent about. But the faster metabolism causing them to need more sleep is something we have to deal with. And we have to be very proactive and get them, extra sleep, extra time to sleep. They need sleep and their needs for sleep increases. So sexuality, sometimes this age group will begin to have intimate relationships. And I'm actually thinking that sometimes they're young. We wouldn't encourage it young, but I'm thinking more 18, 19, 20. But we always have to give them accurate information about sex. They may not ask you ever again if if you don't give them accurate information. One of the things as a nurse we can do is encourage abstinence. And you can explain why you are encouraging that. You're trying to prevent unwanted pregnancies. And you're also trying to prevent STIs, which are making a big comeback today. So, sexuality is a real touchy subject. And if an adolescent brings it up to you, you have to handle it properly so that they will talk to you and get great advice from you. So hospitalization is tough on adolescents in general. They're concerned about their body image and they're concerned about being away from their peers. Their whole life is their peers and they're worried about their body image. The perception of how bad their illness is based on the degree of body changes. So for instance, if they're in chemotherapy and they're losing their hair, they're going to think this is really a bad disease and something bad could happen to me. If they're just being treated with IV antibiotics, sometimes they don't perceive that as being horrible, even though an infection can kill you just as much. So it depends on the degree of the body changes. They sometimes, if they're in the hospital a long time, or if the treatment has changed their body, they develop a body image disturbance. And we see that often with kids on chemotherapy, or sometimes if they have an osteosarcoma or something and they get their leg amputated, they start to get a bad body image. They're embarrassed if they lose control. If they have pain, sometimes they won't tell you, especially if their friends are there. If they lose control, if they really are scared, and maybe they start crying because they think they are going to die, they'll be so embarrassed that they might not confide in you. Experience feelings of isolation from peers. Yep, they feel isolated and they hate it. Concerned about the impact of school and activities. Okay, so we have two different things here. Sometimes they're going to be in the hospital maybe for a while, and so they're worried about their grades. Am I going to graduate with my peers on time? And when can I start having a tutor, and what can I do with that? And activities. Is somebody going to replace me as quarterback on my team? Or am I not going to be a forward on the soccer team? Or do they get another flute player for the orchestra? So they're concerned about this illness and what it's doing to their schoolwork and their activities. A lot of times they go home and they have to do certain treatments, maybe physical therapy or whatever. And what we have found is they may not adhere to treatments due to peer influence. So everybody's going out for pizza after school, and this guy's got to go to physical therapy. And like, I'm not going there. Or he doesn't have his medicine with him and he can't take it. And so he starts skipping it here and there. Or he doesn't want anyone to know he has to take medicine. We see that with adolescent diabetics. For pain, they use a scale of 1 to 10, and they're usually very accurate when they feel comfortable with the nurse. And nursing interventions is number one, get those kids in there to visit him. Being stuck in a hospital is not fun. Number two, all hospitals have child life workers, and they know every age group and what every age group likes. Talk to them and let them be part of this time period for this adolescent. Hi, Scarlett. Spend time with them. I have gotten so far by just sitting down and talking about what do you do, where do you go to school, how's your grades, and after you're here a week, we can get you a tutor, not before, but if you get your homework, I'll help you with it. You've got to be a friend to these adolescents. Taking care of pediatric patients is different than adult patients. Although you've got to give empathy and be loving to an adult patient, these pediatric patients need different things. And this age group needs to know that you're willing to help them. And even just knowing that may make all the difference in the world. The death, they treat death just like an adult will. If it's going to be, them, they're going to have difficulty accepting it. They just now started the best time of their life, and it's going to be tough. They can be really stressed due to changes in appearance. They may feel guilty and shameful that they aren't, able to go to school and do what everybody else can do. And they may feel guilty for their parents' sake. They're going to leave and their parents are going to be so sad. And what a lot of times happens is all of a sudden when death is, something that's discussed, they no longer relate to their peers. But once again, they come back and communicate with their parents and relate with their parents more because their parents are hurting. And they know their peers are going to go on and have a good life, and they're not. Death also can be when they lose someone, whether it's a friend or a family member, And when we say has difficulty accepting due to dealing with puberty and self-images, they really may have a hard time with that, and they may become angry and sad, and then they're like they feel shame for how they're acting if they're crying. So we really need to give this age group a lot of empathy. And safety. As I said before, this group is the risk takers. So once again, we're going to keep all firearms and ammunition away from them. We're going to teach them that they need to use proper equipment for sports. We're going to be a little bit concerned about mood changes with this age group. And especially if we start noticing poor school performance or lack of interest, social isolation, or if the family is saying that there's a disturbance in appetite or sleep, or if the patient themselves says they've had some thoughts of suicide. Whenever a patient says anything about suicide, we need to get mental counseling right then and there, even if they're kidding, right then and there. Burns will teach again about fire safety. We'll really teach about sunscreen. Now, if they've once been burnt, usually you don't have to teach that so much. And then we have to teach them to avoid tanning beds. And that's usually more the girls. They think it's pretty, but it's just as dangerous as laying out in the hot sun. Drowning for this age group, we have to teach them they always need to swim with someone else, never alone. You never know when an accident's going to occur. Motor vehicles, we need, of course, to encourage them to take the driver's ed courses and to have a license, to use their seatbelts, to discourage the use of cell phones, teach dangers of drinking and driving. And we have to encourage families to be good role models for the desired behavior we want in our adolescents. If their father drinks and then drives and laughs about it, this kid's going to do the same thing. But remember, he's not going to be as realistic as his father. Maybe his father did just have one beer and drink water. This kid's going to drink because he thinks his dad drinks and drives. Lastly, but not least, substance abuse. As their nurse, you need to monitor for signs of substance abuse. You know, you look at their nose, you look at their hands. You see if they're shaky and steady, if their eyes are reacting to light appropriately, or just sometimes a gut feeling with them. You can talk about substance abuse with them. And you can talk in third person. I know a kid that did blah, 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 and I'm very concerned. What should I say to them? And sometimes the adolescent will come clean. You know, it's like one of the easiest things for me to do is use a third person, and it has worked for me 9 out of 10 times. Last but not least, of course, is to teach them to say no to harmful substances and alcohol. And I think very educated adolescents that comes from families that are, you know, part of their lives and with them all the time, and the child doesn't resent their caregivers. I think they do better than some of the children or adolescents where the families have never talked about it at home and are not good role models. So this is the end of the adolescence, and I hope you enjoyed this PowerPoint of adolescence. We'll talk more about it in class, but all of the PowerPoints on growth and development are to be used in addition to reading your book. I tried to pinpoint the most important things, but you are responsible for these chapters in your book as well. So on that note, I will see you at class, and I think you're well versed now on the growth and development of the pediatric patient.